Good afternoon and welcome to the Department of Behavioral Health Update. We're live again, and so if you have questions, please put them in the chat as we go through the presentation, and as we get towards the end, I will answer those questions. As usual, if you're not able to watch this live and you're watching a recording, you're always welcome to send us questions either to myself or Tina Young, my assistant, and she'll get them to me, and we'll try and reply back to you via email, and we'll also answer questions at the next update. Okay, it's still Black History Month for a few more days. We had a great Facebook Live, I think it was, on code switching last Friday. And on this Friday, we have a presentation on Black wellness in our community. So both of those will be available by recording. If you either weren't able to watch the code switching live last week or unable to watch this week, you can watch afterwards, just like you do these recordings. This week is also National Eating Disorders Awareness Week, and there is a presentation also available on that went out through our DBH events email address. You should have gotten that today, so feel free to tune into that National Institute of Mental Health presentation. I was listening to a podcast last night that had on it was featured some eating disorder information and some individuals who've experienced eating disorders. And one thing I found really interesting about it was several of the people that the interviewer talked to, and the interviewer has had an eating disorder as well, talked about the fact that they had kept it a secret their whole life, even from their counselors or mental health therapists, which I really found fascinating. So clearly we have a lot more to learn about eating disorders and how to address them. So I highly encourage you, if you're interested, to watch that webinar. Okay, COVID. We're now over 112 million recorded cases of COVID worldwide and just under 2.5 million deaths. Hard to believe 1 year ago we were just at the very beginning of this pandemic. And in the United States, we're over 28 million cases of COVID, and we did pass a milestone the last few days. We have exceeded 500,000 deaths. And I know in the beginning that just seemed incomprehensible that we would have that many deaths. And just to put it in perspective, you know, a lot of our deaths from flu are estimates each year based on data that we have, and that's about 10 times the number of flu deaths that we typically have in any given year. In California, we now are at 3.455 million cases and just under 50,000 deaths, 49,877 deaths. We continue to test daily, about 130 or 40,000 tests a day. And there's been over 7.7 million vaccines administered. We're continuing on that downward trend with positivity across the state. We're now at 3.1% for the last 7 days. That's about a 0.5% decline from last week. In Fresno County, we're just under 95,000 cases now, 94,741, and we did exceed 1,400 deaths. We're now at 1,401 deaths. And so another grim milestone for us in Fresno County. Good news on the hospitalization front. We're now down to 241 known patients in the hospital, 63 in the ICU, and up to 18 available beds. So if you look over on the right, you'll see that hospitalized number is steadily declining while the ICU beds available going up. And bringing those numbers down is really what got us out of that most recent stay-at-home order and back into the purple tier. The next slide shows you that we are continuing our downward trends, both in terms of positivity rate as well as number of new cases per day per 100,000 population. 6.6% positivity puts us in the red now for 2 weeks on positivity rate. We have to get under 7 on the case rate, but at our current trajectory, we hopefully will get pretty close to that next week, and hopefully by the following week, if we can continue with this downward trend. Remember, we have to have both of those measures in the red for 2 consecutive weeks to get out of the purple tier. So we're at least probably 3 weeks away from having those 2 consecutive weeks, and that's if next week we get into the red on the case rate. And so the other thing that you may have heard in the news is school sports hinges on that case rate being at 14. So it's looking really, really good that we'll get to that 14 level by next Tuesday if you're interested in school sports getting back in play. All right, vaccine update. As of yesterday, or around midnight, we had administered 163,091 vaccine doses in Fresno County. There was some graphics shared with us this week that I wanted to share with you to talk about where do those doses go. And so the federal government allocates all of the vaccine across the United States. And some of that vaccine comes directly to California for California to determine how it's distributed. There's also some federal distribution. So the federal government is distributing directly to pharmacies. The original destination of the vaccines that went to pharmacies was to long-term care facilities, skilled nursing facilities. So they were prioritized in the beginning of the vaccine distribution because they have a much higher death rate. By far, particularly in places like New York State, the highest population that suffered death with COVID has been individuals in skilled nursing facilities or nursing homes. And so that was the first priority population, and CVS was the pharmacy that administered most of those. And then to CVS and Rite Aid, and I believe they just added Walgreens to that for the 65 and older population. So now you can go directly to a CVS, a Rite Aid, or a Walgreens and get a vaccination if you're in the tier of 65 and older. And most of those facilities have about 40 or 50 doses a day. Not every CVS, Rite Aid, and Walgreens will have vaccines, so you have to go on their individual websites and find whether or not they have the vaccine and go through their scheduling system in order to get the vaccine through a pharmacy. The federal government is also distributing vaccine directly to federally qualified health centers, and that is to ensure that they are able to capture underserved population. All the federally qualified health centers, their mission, if you will, the purpose that they have is to serve underserved population. They're often in rural areas or areas that don't have a lot of other healthcare providers. And so in Fresno County right now we have United Health Centers, but most of our other FQHCs is what we call them, federally qualified health centers, are also submitting to be able to get that direct distribution from the federal government. And then of the doses that come to California, some go directly to facilities or organizations that have a presence in multiple counties, and also to correctional institutions. So Adventist Health, Kaiser, and the California Department of Corrections get direct allocation from California. They are counted if the doses that they receive or that skilled nursing or federally qualified health centers receive are administered in Fresno County, they are counted in the doses that we administer. And so some of our Fresno County allocation that comes directly from the California state government comes directly to the Fresno County Department of Public Health. They redistribute it to primary care providers, the clinics run by the Department of Public Health, which included the clinic that we ran through Exodus, OptumServe, a company called Curative that's out at Gaston Middle School, UCSF Fresno. They have mobile clinics, and they're part of our COVID equity project here in Fresno County, and a few others like the Sierra Pacific Orthopedic gets their vaccines, and we have been giving some to federally qualified health clinics as well. And then direct shipments of the Fresno County allocation go directly from the state to community medical centers, United Healthcare, and Sierra Pacific Spine and Orthopedic Center. And so they get direct shipments of vaccine. Now this next slide talks about where actually who got how much vaccine. You'll see a little discrepancy between what I reported a couple slides ago at 163,000 doses administered in this slide, because it's just from a few days ago. But it kind of shows you that of the first 146,000 doses administered in Fresno County, about 101,000 represent first doses, so about 10% of our population has gotten their first dose of vaccine, and 43,000 people have also gotten their second dose of vaccine. So there's about a certain number of people who have not gotten their second dose. And we've administered almost 8,000 vaccines in the last 7 days. Now, for a while there, we were getting about 8,000 doses a week, so that's good. We've been administering almost all of those doses each week. Starting last week or the week before, we started getting close to 20,000 doses. So for the last 3 weeks, we've gotten 20,000 doses. So you'll start to see those numbers really significantly increase. And you'll hear more and more about additional populations, the 65 and older instead of just the 75 and older, and then agricultural and food workers and school personnel, education sector getting vaccinated starting over the next few days. And so it's really starting to open up a little more, and we should expect to see significantly more vaccines administered in our community over the next few weeks and months. Now, you might have heard that Blue Shield has a new role in vaccine administration across the state. And so this box of the allocation that comes directly to California and how we get our allocations is what Blue Shield will have some control over. And then Kaiser Permanente will also have a role. Blue Shield, think of to the general population in the tiers, and then Kaiser will have a role with specialty populations. We don't know a lot of details about that, but that just gives you an idea of where in this structure they fit in. So I wanted to talk a little bit about the Johnson & Johnson vaccine. A report was published today from the FDA that there are no safety concerns with the Johnson & Johnson vaccine. They meet tomorrow to vote on approval, and it's widely expected that they will approve the Johnson & Johnson vaccine. Just a little note, all of the vaccines that are getting approved right now are getting what's called emergency use authorization. And while we've talked about it before, because some people have some concerns about the safety of the vaccines simply related to the speed of the vaccines, they're getting emergency use authorization not because they skipped steps. All of the required safety steps have been met with each of the vaccines, but they're not getting full approval yet because just not enough time has passed for the longer term effects to be observed. So eventually, each of these vaccines will have that time period occur where they'll be able to report out on the longer term data and then get full approval. That's anticipated. Johnson & Johnson has committed to providing 100 million doses of vaccine by June and 20 million doses by the end of next month, March. What's really significant about that is that's in addition to the 300 million doses that Moderna and Pfizer have committed by the end of July. And remember that Johnson & Johnson vaccine is a one-dose vaccine. So when you talk about 100 million doses, that is 100 million people, as opposed to the 300 million doses is really 150 million people. So it's almost doubling the number of people just with one additional vaccine becoming available. Next up in terms of vaccines will be the Astrazeneca vaccine and the Novavax vaccine. Both of them have fully enrolled all of the participants in their trials. The AstraZeneca did that at the end of January, and Novavax did it just last week or so. And so they have to have at least half of the participants be 8 weeks out from the second shot in order to begin that approval process. So we're several weeks out, a few months out from those two vaccines getting approval. But it's still critically important that we get additional vaccines because we need a lot more vaccines to be available, not just in the United States, but across the world. And it is important that the entire world go through this process because the virus doesn't know the borders, right? And we have a really, really connected world nowadays. And so if we allow that virus to fester and not be treated in some of the underdeveloped or poorer countries that might have difficulty obtaining vaccines, then we make it more likely that those terrible variants occur that result in us having to always reconfigure those vaccines to address new variants. Now, I will say that the Moderna vaccine has a booster shot to address the variants ready for human testing. I've reported on that previously, and so that work is ongoing, anticipating that we might need those boosters. Most of the vaccines have some effect on all of the variants, but it is important for that work to continue. All right, so how does the Johnson & Johnson vaccine work? We talked a little bit about mRNA vaccines previously because remember both the Pfizer and the Moderna are messenger RNA vaccines. And so I wanted to talk a little bit about how Johnson & Johnson works. So on that left-hand side, you see that the coronavirus. Remember, we have that graphic at the beginning of all of these presentations. And inside there is a spike protein gene. So that little representation of the genes, just that little red part, just represents that only part of the DNA of that virus is the spike protein. And those spikes are on the outside. And so Johnson & Johnson uses an adenovirus. And that's just a type of virus that many years now we've been using to deliver vaccines to individuals. So it's an inactivated virus. It doesn't cause you to have any problems. It just is a means of delivering information to your cells as a vaccine to create those antibodies. So that little DNA of the protein found on coronavirus is inside the adenovirus that's in the Johnson & Johnson vaccine, and it gets put into your body and comes into a cell, and it expels that DNA, and your cell creates messenger RNA. And that messenger RNA goes out and teaches your cells to make that protein. That's why, for those of you who had the shot, maybe it was a while before you had that immune response. It takes a little time for your cells to get that DNA and the messenger RNA that it brings and generates. And the messenger RNA, remember, is just little instructions to your cell to make this protein. All right, so that protein then is in what we'll call a vaccinated cell. That cell is translating the messenger RNA, it's creating the little spike protein, and then that kind of goes out and provides spikes to that vaccinated cell. And so then what happens is you have other parts of your immune system that confront that and go, that doesn't belong here. I don't want that in here. And so it kind of grabs that spike protein and creates what we call an antigen-presenting cell. And the antigen-presenting cell gives a message to what we call a helper T cell. This is probably a lot more information than you want, but hey, you're stuck with me. And that helper T cell then also communicates with what we call a B cell, which is just another part of your normal, regular immune system. And what it does is two things. The B cell secretes these antibodies, and the antibodies basically block the coronavirus spike protein from attaching to cells. And so it basically attaches to the spike and doesn't allow it to present itself to other cells. So it kind of covers it up. So those antibodies, when the virus eventually comes in, you have those little antibodies floating around because you've had the vaccine, and when you taught your body to produce this antibody, then those little antibodies join with the spike protein and don't let it get into your cell. And then eventually, it also really begins to kill the infected cell. And so if you get an infected cell with coronavirus, that activated killer T cell that your antigen-presenting cell helps to feed and create now kills the vaccine. So it kind of does two things. It prevents those spike proteins from infecting your cells, and then if your cell does get infected, it kills it. So that's how pretty much all the vaccines work. They just get that mRNA in different little vehicles, if you will. So think of it this way. We're all going somewhere, but one of us flies and one of us takes the train and one of us drives. That's how vaccines work. It all gets you to the same destination. It just does it in a slightly different way. And so the point being that you have to get that messenger RNA into your body to teach your body to make that protein. The protein then causes your body to create the antibodies, and the antibodies do the work once the vaccine comes into your body. So that's your little science lesson today. I will acknowledge that all of this information comes from the New York Times. The New York Times has some really, really great graphics and really easy to read information about vaccines and how they work, about where they're at in the clinical trial and approval process, and it has the same information about treatment. So in lots of my presentations, what I'm showing you are things I've learned from that website, and I highly recommend if you're a science nerd like me that you go to that website, and if I didn't explain it well, you'll definitely have a good explanation if you read it there. Okay. So with all of that scientific mumbo jumbo, I did want to just talk a little bit about how the variants work. So this slide will probably be a little difficult for you to read, but essentially each of the variants alters the structure of the protein. So the protein is the spike, that red spike. You'll always see it as a red graphic for the most part. And so with the UK variant, basically it affects part of the site that facilitates the virus's entry into the cell. And so it kind of impacts that. In the South African variant, I've got to find my notes here. Well, with each of them, it really just impacts that protein. It either makes it easier for the virus to get into the cell and bypass what your antibodies are trying to do, or it makes it harder to detect. And so that's the thing that they're really looking at with these vaccines, is how can they counteract the slight changes it makes to either the surface of the virus or the protein structure and such. And so this information was in the Wall Street Journal. So if you want to find out a little bit more about how the variants work, you can read about that in the Wall Street Journal. But that's how the variants impact that spike protein largely, is what it changes. Okay, so I've been asked a lot, and you'll read a lot about it. How are we going to know when this darn pandemic is over? And let me be very clear. When I say pandemic, I don't mean COVID's being gone. You might see in the media zero COVID. That's certainly a goal. There's not many viruses, though, that we've fully eradicated, even when we've had vaccines. And even some that we thought we fully eradicated, every once in a while will pop up somewhere. So it's probably unrealistic to think that we're going to get rid of COVID, that COVID will disappear and we'll never have to deal with it again or deal with vaccines. But how do we get out of the pandemic emergency? Because you can have a health emergency, you can have a heightened concern, but a pandemic, and you can have an epidemic. Remember, an epidemic precedes a pandemic. A pandemic is when it's worldwide and it's everywhere and it's, causing problems for all of us. So when are we going to get out of that stage where it's not at the forefront of our thought every single day? And so I'm going to touch on it today, and next week I'll go into a lot more detail. But what are the things that we should be looking at? We have all kinds of measures we've tracked. We've tracked availability of ICU beds and hospitalizations, and we've tracked deaths, and we've looked at the positivity rate and the case rate, and now we're looking at the vaccination rate, and we're also looking at the number of people who've had COVID and any immunity they may have had, and that herd immunity goal. And so all kinds of things have been tracked through COVID, and now the variants, and how rapidly the variants are developing, and whether or not they're going to be impacted by the vaccines. And so next week we'll talk a little bit more about what the experts are saying we should be looking at, and what the metrics should be that should be the sign that we can breathe a little bit easier, begin to think about more normalcy, and then what will that mean? A lot of people have asked me, I've had the vaccine, do I have to keep up with the precautions? Yes, you have to keep up with the precautions. At this point, there's no guarantee that just because you've had the vaccine, you can't still acquire the virus. Generally, we believe that if you do get the virus after you've had the vaccine, you'll have a much easier course of it, a much significant to no chance of dying from it. But that doesn't mean you couldn't get it and spread it to other people. Now, there has been new guidance that's come out that if you've been fully vaccinated, which means you're 2 weeks out from your second shot, that you don't necessarily have to quarantine if you've been exposed to someone. The county's looking through that, and a health officer order came out about that, and we'll talk about that more as we get guidance from our own human resources department. But so those are all things that kinds of questions that are being asked. And when will we know? Is it the red tier, the yellow tier, the orange tier, the green tier? I don't know. And so next week we'll talk about what are the experts saying, that what's the case rate, what's the positivity rate, what's the death rate, and they have thoughts on all of those things. And then we'll compare that to where we're at today and talk about some trends and think about when we might feel a little more normal, more globally. Now, locally, we may get out of some of the precautions and restrictions sooner or later, depending on what's happening locally, but the concept of the broader pandemic really is going to rest on a variety of measures. So next week, we'll go into a little more detail about that. All right, so in terms of county updates, still looking at telework continuing through March. I say this every time, I'm going to say it again. We just don't know what's going to happen. One thing we've learned through this whole pandemic is you can't make assumptions. We're on a great trend right now. Oh my goodness, it's such a blessing to anticipate we could get out of this purple tier again. But the variants are running around and not everyone's vaccinated. And so, we still have to keep up with those precautions. We still have to be vigilant. And if we're not, then things aren't going to get better. So we'll be looking at the tier and the volumes and the variant activity and vaccinations over the next several weeks before we really understand how long the emergency orders and some of the other directions we've gotten from our county, our CAO, our Board of Supervisors, how long they might last and when they might end. I will continue to emphasize that testing remains critically important for us. Just because we're getting vaccinated, just because we're seeing improvements in all of our metrics, testing is going to be vital, even more vital as we move forward, to ensure that the signs we're seeing are real. If we stop testing, if people get complacent and say, well, I don't need to test, or I'm not going to worry about this sniffle I have, or the headache, or the sickness I'm feeling, then we'll have a false sense of security and we'll have a surge again. So the testing is really, really important to be a check and balance and ensuring that the numbers that we're seeing are real, right? That those case rates and that positivity rate are not because we're not testing. The other thing is that the state's looking at our rate of testing. And if they see it going down, they won't give us the same credit for the numbers that we're reporting. So we have to keep testing. And with that, wear your mask, stay apart. Let me look at the questions. This was about a staff member who got the first vaccination at Pathways and is due for the second one next week, and how should they follow up getting the second vaccination. So we did have a number of staff in the behavioral health system who were not able or chose not to get vaccinated in what we'll say the first group of first doses. And so our clinic at Pathways that Exodus ran for us, and a lot of our staff support as well, mostly our nurses, they finished. Okay, so last week was the last week they were in operation. But that last couple of weeks of operation, we had extra doses beyond what we needed to give people their second dose who had received their first dose through the initial round. And so we did offer first doses to people who were on a waiting list to get that first dose. your second dose will be received at another county clinic. And so if you have a question about that, please contact dbhvax@fresnocountyca.gov via email. Let them know when you got your first vaccination, and they will assist you in getting your second vaccination. We have a list of people. We did keep track of everyone who got their first dose during the second dose vaccine clinics. And we're working within our county system to ensure that you get scheduled for your second dose. But if for some reason we haven't communicated with you, or you're getting worried that you're not sure what to do, just contact DBH Vax and we'll work with you and make sure that you know. And then, has anyone in our department passed away from COVID? I am not aware of anyone in our department who's passed away from COVID. I will tell you that there's a number of our county partners who have had loved ones who've passed away, not necessarily all in our department. So I do believe, as we see that death rate go up, as we see 1,400 people in Fresno County dying, that 6 degrees of separation gets really close to us. And I personally know of people who've died of COVID. I have family members who were hospitalized with COVID. And so the question just highlights that it really becomes personal when that does happen. I'm not as familiar with other parts of the county, and so we can ask that question. I don't know that we're enabled to know, but I will ask that question. And then, I'm concerned that when schools return but are not full day with after-school programs, how will that impact employees that don't have other child care options? What I would say to that is just please work with us. We recognize that it's going to be a rocky road for a little while. And what I mean by that is that we may have some stops and starts depending on what those metrics tell us. The schools, it's really great that school staff are getting vaccinated. I think that will give all of us some assurance that this return to school will be a smoother process. But we do recognize that with the return to school, it won't necessarily be 5 days a week or all day long or whatever your usual routine was. Some of those child care options may be different. And so we'll continue to work with staff on options for making that workable. I can't promise you anything right now, but I will tell you that we recognize that those issues are out there, and we want to work with you as we go through this process, knowing that it's not going to be like turning a light switch on and off. All right, I don't have any other questions on the YouTube, but let's see. Is there a wait list for unused vaccine for people that are not on the current tier? No, we don't have a wait list for people who aren't on the current tier. The way we've utilized the wait list is we have a waiting list of people in the current tier who haven't gotten a vaccine yet. And the wait list we used at our Exodus clinic was employees that I just mentioned that just missed out on getting an appointment through that first round. We encourage everyone, if you're in the tier, any tier, healthcare worker, over 65 now essentially, you can go to any place that's open, right? Any place that will give you an appointment. If you're in the tier, you can get vaccinated. And so we use those lists of people who were in the tier but hadn't been vaccinated yet. And sometimes we'd call people and they said, oh, I found another way to get vaccinated. I don't need the vaccine. And we also had a list of people over 75 that had put their information with the county's Department of Public Health, and we called them as well. So we were vaccinating all kinds of people. But you need to wait your turn if it's not your turn in the tier. There's been stories in the media where, there was some vaccine that the people carrying it were involved in a big traffic jam, and they got out of the car and delivered doses to people in cars, whether they were in tiers or not. That's really the exception rather than the rule. And it's really just not an equitable system if people try and game the system and go outside the tier. And it's really frowned on, and I really frown on it because it really disrupts the whole system. Imagine if we just said, well, if you show up, you'll get vaccinated, then people who are more vulnerable, because that's how the tiers were determined, people who are more vulnerable, more at risk either of getting COVID by nature of their job or the work they do, or more vulnerable to getting very sick, hospitalized, or death of COVID based on underlying health conditions or age, are going to miss out on a vaccine because someone wanted to game the system. So I highly, highly discourage people who are not in the current tier from trying to get vaccinated. I understand that when there's a highly desired, scarce resource, it kind of makes people do things that maybe they wouldn't otherwise do. But what I will say is more and more vaccine is becoming available. We will get to everyone. Sadly, not everyone who's eligible wants to get the vaccine, so I think we'll get through some of these tiers quicker than we otherwise would. And so just try and be patient and know that you will get the vaccine when it's your turn to get the vaccine. And then one other question, saying it's not advisable to have a mammogram for at least 4 weeks after vaccine because it can cause false positive spots. I've been reading a little bit about this as well, and so I would say I would trust that if you talk to your healthcare provider, including the provider to do the mammogram, you let them know you've had the vaccine. These types of operations stay really up to date on this type of information and will probably advise you against getting a mammogram if that's what studies are showing. And I'll try and find out a little bit more about that and report out on it here next week. But that's why it's really, really important that you keep in close touch with your primary health care provider to understand what kind of impacts there might be in that regard. All right. And that's all we have. Oh, where can we get more information on first vaccine? If you could kind of describe better what you mean by that, I'm not really sure what you mean in terms of, do you mean where you can get the first vaccine? If someone's interested in getting their first vaccine, you can go on the county's public health website. They have a COVID vaccine webpage. It has a wealth of information in terms of all of the different locations that are currently offering vaccines, what tier we're in. There are things called closed clinics for some tiers, so some school districts will be offering directly to their personnel the vaccine. It won't be a clinic that's open to the public versus like the fairgrounds where anyone in the public can go to that clinic. And so that website describes all of those opportunities and how to access them. And then if you're just interested about what vaccines do or what the side effects are or that type of thing, there's also information on that webpage to tell you more about that. And hopefully that answered your question. And if it didn't answer your question, feel free to send us an email. Please feel free to send us an email with a more specific question. I saw on CNN yesterday that the Moderna may not protect those of us who've been vaccinated. I am not aware of the vaccine not protecting anyone. That sounds like false information, or maybe how it was presented was biased in some way. The variants, 100% for sure, the vaccines have a less effect on most of the variants. Not all of the vaccines work the same on the variants. So some vaccines may be more or less effective on the variants, but at this point, all of the vaccines have some effectiveness against the variants. And all of the vaccine manufacturers are doing research around booster shots, think of them like booster shots, that they might give to address some of those changes on the variants that I showed you on that one slide. So changes to the spike protein, or the ability of the virus to get into the cell, or the ability of the antibody to recognize the virus. And so they're studying those variants, and they're engineering that mRNA response to teach your body how to respond to that new variant and those changes to the spike protein. And so there is no evidence whatsoever that any of the vaccines is either like it was a lie that it was effective or that it's ineffective. Just it might have been something about the variant itself being harder for the vaccine to overcome, or the vaccine being less effective against a variant. That is what I'm guessing. But if you have other information or you want to send us a link to the CNN article, I'd be more than happy to look into it and report out on that next week in a little more detail than I could today. Okay. I see now that it's the California variant that Moderna may not protect us against. I did read a little bit about that, but I will say that I don't believe the article said it wouldn't protect you. It just might not be quite as effective. I would be surprised if it was just Moderna. Likely it would be Pfizer as well that was less protective. But again, those are things, that we have to think about this way. I would rather be vaccinated and not have quite the effectiveness than have no effectiveness at all because I'm not vaccinated. And so I'm willing personally to take a vaccine that I know a variant may develop that it doesn't work as effective as, or it may determine that I need to get a booster shot. That's okay with me. Maybe everyone doesn't feel that way, and I completely understand that. But at this point, I don't believe they think that the Moderna vaccine is not effective against it. It may just be like the South African variant, where some vaccines are less effective against that variant than they are against the COVID virus in general. Hopefully that helps. And then, did I report on returning to the office? Yes, I reported what I've reported every single week, which is until we get out of the state of emergency, we will continue with our current plan. And we'll take into consideration all of the metrics that we've been reporting on for some time now in terms of the safety in our community, the prevalence of COVID in our community, the vaccination rate in our community. And then we'll work with you in sorting through things like kids return to school, availability of childcare, et cetera. So stay tuned. Nothing's going to happen overnight. You're not going to find out on Friday night that you have to come back to work on Monday morning with no time to prepare. That's not how we do business there. We're not going to start doing business that way here. So please rest assured that these are really legitimate concerns. We appreciate you raising them, and we will most definitely take them into consideration and work with you to make the transition back to work as smooth as possible when we get there. We're just not there yet. Okay. And with that, we will end the presentation today. And I wish you all a good weekend, and we will talk to you next week.